Hi everyone, Victoria and Julie here from Gleam Smile Center, and today we're going to be talking about brushing your teeth. So we have a few different toothbrushes here that we have available for demonstration, and we're just going to go through basically how to ideally use each type of toothbrush. Now, when we're brushing our teeth, the main thing that we want to focus on is removing that bacteria away from the gum tissue. So like we talked about in our last video, oral bacteria can collect, and when left sedentary for a prolonged period of time, it can cause an inflammatory response in the gum tissue. So I'm going to show you a quick diagram here. And so in here we see healthy gum tissue and we see inflamed gum tissue. And so something to mention is when we're brushing our teeth, we want to make sure that we're angling our brushes towards the gum line, so that way we're removing that bacteria away from the gum line. Now, in healthy tissue, which you can see over on this side here, okay? Healthy gum tissue is detached from the tooth right at the top there, and it's usually about 2 to 3 millimeters deep. And that's why when we're brushing our teeth, we want to angle that brush so it gets inside of that pocket space. Now, as the gum becomes more inflamed, it starts to push away from the tooth, and you can develop a little bit of bone loss there as well. So you can kind of see that in the picture here. And so that space gets deeper and deeper. And then you have to change maybe the type of toothbrush that you're using, as well as the technique that you're using as well. Now, when you go see your oral healthcare provider, they will let you know the condition of your gums. Sometimes you're unable to feel whether you have that detachment like you can see in the picture there. So they'll let you know how your gums are looking and basically the best method of brushing that is specific for you.
So why don't we start off with power brushes? A lot of people ask us what kind of brush is best. And again, that is so individual depending on what your gum tissue looks like. So again, your oral healthcare provider will better guide you to which is the best one. So we're going to start off with the Oral-B. This works at manually removing any plaque or acquired pellicle that's on the tooth. You can hear, I'll turn it on for just a brief second, where it rotates or oscillates round. And the way you want to use that is you want to hold it on the tooth, and it's brushing tooth by tooth. So you want to rotate it slightly, right? So that way you're getting, we call those the line angles. So kind of in between the teeth, just that corner of the tooth. So a lot of people make the mistake of just kind of going back and forth like this. You need to slow it down and just rotate on each tooth. Mm-hmm. So that way you're making sure that you're getting all of the areas. The only places that are different is on the inside here, just because it fits better, all right? But same with on the inside, the tongue side, you want to be able to rotate it tooth by tooth by tooth. Mm-hmm. Now with every toothbrush or power toothbrush, it goes on 2-minute cycles. So 30 seconds per, we call it quadrants. So every mouth, we break it up into 4s, mm-hmm. right? So 30 seconds, 30 seconds, 30 seconds, 30 seconds for the top. And then your brush generally turns off. Okay, so that's an Oral-B.
That's the Oral-B.
The Sonic, I have Philips Sonicare here, one for the child, right? And one for adult. And the way with the Sonicare, I'll turn this on. Okay, and it's the same thing. You do quadrant by quadrant by quadrant by quadrant, and this toothbrush will tell you when it's time to change sections. And I always tell my people to put a little bit of water. So you put your toothpaste on, put a little bit of water inside their mouth, because what happens, I don't know if you can see that. Can you see that kind of bubbling up? What happens is that when you're brushing your teeth with the water, with the liquid inside, it just kind of flushes everything out from underneath the gum line as well. Mm-hmm. And with this toothbrush, you want to hold it on an angle at the gum line. So half on your tooth, half on the gum, and you do about 2 teeth at a time. And you just let it go. None of this, okay? It's 2 teeth at a time. And with power brushes, you need to learn just to slow it down. A lot of people are just trying to get through it. Slow it down and just do two teeth at a time. Do the outside and then do the inside. Now on YouTube, you can. They have great tutorials on if you search Philip Sonicare. They have a great tutorial on how to use their toothbrushes, as well as Oral-B. They have great tutorials as well, so you'll be able to see up close demonstration.
Exactly. Now we're going to talk about manual brushing. So with a manual brush, a lot of people think that manual brushing is not as effective as power brushing. And if you're doing it correctly, that's not necessarily the case. And again, for every mouth, it's a different story. So your oral health care provider will let you know what the best method is for you. So we're going to start by talking about a couple different manual brushes, and I'm just going to get in a little closer here. So we have like a traditional manual brush. This is a style that I like particularly, and it's just because it's called a deep clean. And so what you can see there, and sorry, I know this is an older toothbrush, is that the ends there are a little bit feathered and they go a little bit thinner. So they're getting into that deeper pocket space like we talked about at the beginning of the video. So when you're brushing with this, what you want to do is, again, you want to focus two teeth at a time. So you're just going to angle your brush about 45 degrees down towards the gums, or if you're on the top, obviously up towards the gums, okay? And you're going to put it 45 degrees, and you're just going to do a little bit of a jiggling motion so that those bristles get inside of that pocket space like we talked about, and then sweeping up, and jiggle, and sweep up. And you're going to do that all around the mouth. Again, spending about 2 minutes total brushing your teeth. So you're going to do it on the inside as well, and sweep up. And then you're just going to clean in behind the front teeth, okay? So again, 2 minutes, 30 seconds per quarter of the mouth. Now, we do have children's toothbrushes as well, and they're a little bit different because they're a little bit smaller, so they're for the smaller teeth. And children's teeth are shaped a little bit differently. So an adult tooth is kind of tapered in towards the gum line, whereas baby teeth or children's teeth are shaped a little bit rounder, like balls. So what you're gonna do is you're just going to brush in little circles, okay? And that's easy, especially if you're trying to teach them how to brush their teeth. Keeping it simple, doing circles is really effective. Now, a brush like this, and this is one that I like specifically, because a light goes on for about 2 minutes.
It has a little timer.
Yeah, so it lets them know how long they should be brushing their teeth for. Now, of course, when it comes to children teeth brushing, it is advisable that mom or dad or a caregiver is there to supervise and make sure that they're doing it correctly and thoroughly.
And especially supervising the amount of toothpaste that they're actually putting in and making sure that they're not swallowing the toothpaste.
Exactly.
I just want to go over this little brush here before we go into the other section, Victoria. This is called a sulca brush. And for those the people who have the deeper pockets where the gum tissue is just a little bit flappier, I like this because you can take the bristles and just go right along the gum line, right? And get those bristles to get right down underneath the gum line. And then once you get in between, you give it a tiny little jiggle and then run it along the gum line and then give it a tiny little jiggle, right? So you've got two sides to this brush, one that faces out and one that faces in like a hook. And it's written on the handle, outside, inside, and the inside meaning inside the mouth, all right? So again, the same thing, you just run it along the gum line, so that way you're able to get into those crevices to disturb all that bacteria inside.
Perfect.
Now tomorrow we'll be talking a little bit more about interdental cleaning or cleaning in between your teeth and mouth rinses, but it's super important that you brush your tongue or you have a tongue scraper, right? And also brushing the inside of the cheeks and the roof of the mouth, just kind of sweeping through. But getting a tongue scraper, a lot of people forget about the tongue, and that can harbor a lot of bacteria, so we want to clean that as well.
Absolutely. Now, kind of a hot topic right now, and a product that everyone seems to be a little interested in, is the bamboo toothbrushes. So we have a couple different variations here. We've just been testing them out. We ordered a bunch off of Amazon just to see how we like them and what we can, recommend. And so all of them tend to be pretty similar. They're all soft brushes, and that's something I forgot to mention too with the other toothbrushes is you want to make sure you have a nice soft brush. Just so that way when you're brushing, you're not applying too much pressure and it's not affecting any other areas. But what we're gonna do is, again, you're just gonna brush with this the same way that you would any other manual toothbrush. Couple things to mention that we just noticed when we were trying them out is that some of the bristles do fall out. So that's something you wanna be a little bit careful with, especially if you do have those deeper pockets like we were talking about in the beginning of the video. Sometimes those can get stuck in there. So again, just consult your oral healthcare provider before using any sort of new product. Now, these are specifically made for people who want to be a little bit more eco-friendly. And that's why they are definitely more popular right now because that's kind of a huge movement that's going on. And so what you would do with this is after, 3 months or so, because again, we forgot to mention.
Oh yes, you change your heads or
make
change
sure
your
that
toothbrush.
you change your toothbrush heads or you get a new toothbrush every 3 months.
Yeah.
And so with this, same thing, it's gonna last you about 3 months. After use, what you're gonna do is you're gonna take some pliers and you're just going to take the bristles right out. You're gonna pull them out and then afterwards, this handle is either compostable or you can burn it.
The one thing I have to say with the bamboo brushes though is that you absolutely have to make sure that you dry them and you let them air dry because they will
They'll start to get moldy.
Yeah. So if it's kept in a you really shouldn't be keeping your toothbrush in a wet, dark place, right? Environment. But really do make sure that you rinse it off well, dry it off well, and let it air dry. So that's the one thing with that.
Perfect. Anything else you want to add about brushing?
I don't think so. We mentioned the tutorials online for the Philips Sonicare and the Oral-B. We mentioned the making sure that you get at the gum line at a 45-degree angle. And kids, nice big circles. We could talk about toothpaste and interdental brushing
and mouth rinses in our next videos.
in our next one.
And of course, if there's a brand or product that we didn't go over in our brushing video today that you're curious about, feel free to message us and we can always go over that with you or include it in a following video. Until then, I guess
We'll see you again.
we'll see you again. All right, bye.